Hi, this is Christina Bornman, and I will be presenting on occupational therapy and its role in the mental health of children and youth. I wanted to start off by doing a quick review of what occupational therapy is and what occupational therapists do. Occupational therapists work with patients to achieve overall health, well-being, and we want the patients to be able to participate in life through engagement in occupations. And that's specific to the patient's life and what the patient wants to achieve. So what are occupations? Occupations include activities of daily living, which for this presentation would include bathing and showering when age appropriate, toileting and toilet hygiene, being able to dress themselves, possibly pick out their own outfits, swallowing and eating, feeding, functional mobility, and again, age appropriate personal hygiene and grooming. It also includes instrumental activities of daily living, which for the latter end of the age scale might include care of others, maybe a sibling or an elderly family member, include care of pets, communication management. That would be for all children. We want all children to be able to effectively communicate with their parents, their teachers, their healthcare providers, their peers, their friends, whoever the child would like to communicate to. We would hope that they would be able to get their point across effectively. Again, for the latter end of the age scale, there's driving and community mobility. We have, rest and sleep. Of course, we want everyone to be able to prepare for sleep and effectively participate in sleep so they're able to sleep the whole night through and wake feeling rested and ready for the day ahead. Education, we want all of our children to be able to succeed in their educational pursuits. That includes working in groups, completing tasks on time, completing appropriate deadlines. Work for the latter end of the age scale, possibly. Play, we want all of our children to be able to play effectively and creatively and, have that outlet for their extra energy. Leisure and social participation, whether that means just interacting with their family or their friends and volunteering in their community. We want our children and youth to be able to do these things if that is something that if that is something that would enhance their life. Now, occupational therapy and mental health, from my perspective, I didn't really ever know that they went together as closely as they do, which is why I picked this presentation topic, because I wanted to know more about it. I think occupational therapy has a hard time on its own getting the word out about what it does, and it's such a broad spectrum. So what do these two things have to do with each other? Occupational therapy helps the patient be able to cope and determine effective ways to carry out successful occupations. And this differs from other mental health prospects like therapy and psychology, in that in psychology and therapy, the patient may learn coping strategies, but not necessarily how to intertwine those in their daily activities and daily occupations. And that's what occupational therapy does, and we'll get into that a little farther. So here are the age parameters I was speaking about previously. Preschooler is 3 to 5 years, grade schooler would be 5 to 12, and teen is 12 to 18. And that's who I was including in the latter end of the scale with the driving and the employment. We don't really include anybody preschool or 3 to younger in this presentation because those years of your life usually determine the mental health of the child, whether they'll be stable or unstable, due to circumstances such as trauma or bullying or things like that. I mean, that's not to say that children under 3 don't need occupational therapy. It's just that that's when the foundation is being laid. And if they are already receiving occupational therapy for, say, a circumstance that they were born into, such as autism or Down syndrome, then the mental health aspect would be intertwined with the physical, and so it wouldn't be separated. We as occupational therapists are always striving to make sure that our patients are successful in achieving their daily occupations to ensure a successful and happy life. So if the patient is already receiving occupational therapy, mental health coping skills and things of that will be included. For these age groups, what type of situations or circumstances will lead to them needing occupational therapy with a mental health focus? Things such as anxiety from maybe moving too much, or an unstable life at home, or parental fighting, a traumatic experience, whether that's emotional or physical, neglect, emotional abuse, physical abuse, in the school system, or not even in the school system, but any type of bullying, any type of grief, especially sincere grief from losing a parent, or losing a pet, natural disaster where your whole life is turned upside down, terrorism, refugees of war. And this is not an exclusive list. This is just a general overview of type of circumstances that would lead to children and youth to need to receive occupational therapy with a mental health focus. But again, it's not exclusatory. These type of circumstances can lead the child to not be able to successfully complete their daily occupations, whether that's getting a full night's sleep, or not wetting the bed at the latter end of the age scale, not being able to eat because they're so worried they don't have an appetite, low school grades, they're not able to focus on the things they should be focusing on, they're not meeting deadlines, or they're not able to work in groups, they pull away from their family and peer relationships, they kind of go in on themselves, depression, anxiety, all of these things will lead to a need for occupational therapy with a mental health focus. So once the patient is brought in for occupational therapy with a mental health focus, what happens? Well, the occupational therapist will do an evaluation and see where the patient is not excelling, see where they would like to see improvement, see what the patient's specific goals for their life are. It's always patient based, so it's never the same. It varies by patients. So the occupational therapist will help them create reasonable daily goals to complete their occupations. That could mean making out a list of tasks that they'll complete that day. I'll wake up at 7, I'll get dressed from 7 to 7:20. I'll eat breakfast from 7:20 to 7:40. I'll get ready and I'll be out the door by 8. If that's too vague or non-specific for the patients, then they'll create, more specific. I'll lay out my clothes the night before. From 7 to 7:05, I'll brush my teeth. From 7:05 to, obviously, no one brushes their teeth for 5 minutes, but from 7:05 to 7:10, I'll wash my face. Just helping the patient feel more comfortable completing the daily occupations they need to do. If for a week their only goal is to brush their teeth in the morning, and that's what the patient can handle, then that's what they'll do. So it's very patient based and it's flexible. And if the patient isn't succeeding, they'll try different strategies. They'll help with coping strategies, whether that's journaling to get your feelings out, learning to cope with, possibly, creating a study schedule so you don't feel so overwhelmed and full of anxiety in your classes. They'll also monitor medications and side effects and their overall effectiveness for patients who require medication. Now, as we all know, occupational therapists aren't able to prescribe or any of that, but they'll just keep an eye on the patient as well as other healthcare providers to make sure that the medication is doing what it should be doing, to make sure the patient is showing the appropriate actions and side effects. And the occupational therapist will also work with and educate the parents or caregivers, especially for the children on the younger end of the scale. It'll be, it could be more of a group setting rather than just, obviously, you can't tell a 5-year-old how to schedule their day, but, you can work with the parents to try to give the patient a little more stability if I'm speaking from a perspective of anxiety or worry. So once the occupational therapist works with the patient and the family, who benefits and who sees the results? I mean, obviously that'll be the parents and family members, the patient or child themselves, hopefully the school staff if there was an issue, communities if the child is more able to be more involved in their community. There's a video link to a great video. It's about 3 minutes long. It is part of the presentation. I'll just give you an overview. It's about a mom speaking about her child going through occupational therapy and before and after. And we'll talk a little bit more about it after the video. As we heard from the video, I love how happy and excited the mom sounds for Grace. She mentions how thrilled Grace was after she was able to tie her shoes, and it gave her the choice of being able to choose what she wanted to wear, not based on her ability, whether or not they were slip-ons, but based on what she liked. It improved her self-esteem. She was more on level with her peers. I love how happy the mother is that occupational therapy was able to help her daughter. And in other instances, not only with shoelaces, but in other patients, it'll show improved performance in school, hopefully higher grades, higher marks, more interaction, comfortable interaction with their peers, improved relationships with their family, improved coping skills. So hopefully they're able to, deal with stressful situations more effectively and complete a task even though it might be slightly stressful or uncomfortable, but they'll be provided with these skills to be able to complete it. Which assessment tools are used from beginning to end with an occupational therapist who's focusing on the mental health of a patient? Um, Overall, mental health is included in the comprehensive occupational therapy evaluation that every patient gets, no matter what type of occupational therapy they're there to receive. Because mental health is so intertwined with occupational therapy, you can't perform occupational therapy without making sure that the patient is at a stable mental health level. Other assessment tools could be, as stated previously, having the patient journal, and then you have a physical written proof from the patient's mouth, how they felt before, scared, anxiety, had anxiety, anxious, and then possibly how they're feeling after receiving coping skills and using these coping skills. There is a perceived stress scale, which is on the next slide, which we will go over. Here is the perceived stress tool. It's also, there's a fuller version as a handout. And this could be a very quick, easy evaluation to give the patient to see how they're coping with changes in their life, whether they're feeling comfortable or whether it's giving them high anxiety. The higher the number, the higher the score, the higher the perceived anxiety. And so based off of their score, the occupational therapist can adjust the therapy they're receiving, whether they need more coping skills, whether they need, more quiet time, whether they need more avenues to release energy. But this is a good way to determine a good and quick way to determine how the patient is able to handle stress. Mental health focused occupational therapy has the same overall goals as other focuses of occupational therapy. We want the patients to be able to successfully participate in the occupations of their daily life. We want them to have a full and fun and purposeful and complete life, and mental health focused occupational therapy, especially for children and youth, is able to help that happen and is able to lay a very good, strong foundation for coping skills later in their life. So hopefully they wouldn't run into those barriers again as an adult. There is a word search as a handout. As you see, there isn't a word bank, but if you go back through the presentation, the italicized words are the word bank, and I hope you enjoy it.